Assalamu alaikum. My name is Hala Zafar, roll number EP1770049, and my topic of presentation is anti-epileptic effect. And my subtopic is anti-conversion effect of new 1,4-dihydropyridine derivatives containing imidazole moiety against seizure induced by PTZ and maximal electroshock in mice. Epilepsy is a serious neurological disorder affecting about 1% of the world's population. It is characterized by spontaneous convulsions and or a loss of consciousness. Many effects dedicated to the development of novel therapeutics result in promising anti-epileptic drugs introduced in the past few decades. Many of these drugs have dose-related side effects such as sedation, cognitive impairment, weight gain, birth defects. A few of these compounds may even have rare but life threatening side effects such as severe rash, hepatic failure, cardiac arrhythmias. Studies reveal that calcium is an important factor for the induction of epileptic effect. Different seizures inducing agents or procedures result in increase of intraneural calcium ions concentration, which is thought to be involved in the subsequent epileptic form activity. Calcium channel antagonists are effective against a whole range of convulsive procedures, such as electroconvulsive, sound-induced seizures, amygdala, hippocampal kindling, PTC conversions, high-pressure-induced seizures. 1,4-dihydropyridines are well known as calcium channel blockers and form a major class of drugs used for treatment of hypertension. Recently, investigations have shown that these compounds indicate variety of biological activities, including antimicrobial, myocardial infarction, neuroprotection activity. Also, it is proof that the DHPs, calcium channel blockers, are effective anticonvulsive agents and candidates in the experimental seizures. Methods and materials. We're using a Mayo Naval Medical Research Institute mice, which is about 20 to 30 grams. And the animals were housed in a temperature controlled room, which was about 25 plus minus 2 degrees Celsius, on a 12-hour light and day cycle. And they had free access to food and water. They were placed in standard polycarbonate cages and they were accumulated at least 2 days before experiment. The experiments were performed between 7 to 15 hours, and all the procedures were carried out in accordance with institutional guidance for animal care and use. Each mice was only once used, and the treatment consists of at least six animals. PTC was purchased from Sigma UK. Nifedipine used as standard compound, and the HP's derivatives and standard drugs were dissolved in dimethyl sulfoxide and physiological saline solution. The DMSO saline vehicle was also used as a control group. Because of toxic property of DMSO, minimum content of it was used. Determination of clonic and tonic seizure threshold. The threshold of PTZ-induced seizures were determined by inserting 30 gauge butterfly needle into the tail vein of mice. An infusion of PTZ 0.5% at a constant rate of 1 ml per minute to an unrestrained animal. Infusion was halted when four-limb clonus followed by full clonus of the body was observed. Minimum dose of PTZ needed to induce clonic seizure were measured as index of seizure threshold, and we measure it as threshold is equals to PTZ upon weight. Intravenous PTZ induced clonic seizure model. Dose of 40 mg per kg of 1,4-dihydropyridine derivatives were administered IP. 0.5% PTZ was administered IV in 30, 60, and 90 minutes. The best of effect was observed at 30 and 60 minutes, and the effect decreased at 90 minutes. Also, this procedure was performed for nifedipine as reference drug at dose of 10, 20, 40 mg per kg. Minimum electroshock induced tonic seizure models. A drop of 0.9% saline was instated into the ear prior to the application of the electrodes. During the shock, electrodes were attached to each animal's ear. MES seizure were allocated with 20 cycle AC of 35 MA intensity delivered for 0.2 seconds via electrode. Each DHP derivative was injected IP at the dose of 10, 20, and 40 mg per kg. After 60 minutes, MES was performed. Percent of animals that did not involve THC were calculated. This procedure was repeated for DMSO/saline in order to determine vehicle effect in nifedipine as reference drug. Statistical analysis. For analyzing data, SPSS software version 20 was used. Um, the pi values less than 0.05 were considered as indicative of significance. This is a chart for clonic Caesar threshold. You can see different values here. And this chart is for the effects of different doses of compound on MES-induced seizures. Discussion. Clonic seizures. The anticonvulsive effect of the HPS may be due to the inhibition of L and T type calcium channels and inhibition of N-methyl D L aspartase receptor and interaction of the HPs with adenosine. In comparison to nifedipine, our designed DHPS derivatives have aryl amide moieties instead of methyl ester groups. This replacement results in the increased lipophilicity and better penetration to CNS and better anticonvulsive effect compared to nifedipine. Tonic seizures. Based on our physiological results, it is confirmed that all of our design and prepared DHPS effective protect the tonic seizures. Thank you.